What do you do when you're given a life-changing diagnosis? Today's guest is someone whose story will inspire you, encourage you, and challenge you to think differently about your body, your mind, and how to discern what God is really calling you to do, even in the face of immense challenges. Hi, everyone, and welcome back to the Dr. Terri Show. I'm really excited you're here today because we have a truly powerful, personal, and purpose-driven episode ahead. I am joined by the amazing Dr. Jill Carnahan. She's a board-certified functional medicine doctor, a survivor of cancer, Crohn's disease, toxic mold exposure, and someone who has walked through the valley of personal health crisis and emerged as a nationally recognized voice in functional and integrative medicine. But more than her credentials or her professional achievements, Dr. Jill brings the kind of insight that only comes from lived experience. She grew up on a farm in central Illinois with what looked like an ideal, wholesome childhood, homegrown food, family values, a supportive home. She was valedictorian and on the path to fulfilling her dream of becoming a doctor. And then life hit hard, as it always does. At just 25 years old, while she was in medical school, she discovered a lump in her breast and was diagnosed with a very aggressive breast cancer. Suddenly, her world flipped upside down. So what do you do when your body betrays you, and how do you make these life-altering decisions when you are the medical expert, but also the patient? How do you find clarity when there's no black and white answer? In this episode, Dr. Jill shares how she sought both science and spirit in her healing journey, combining conventional treatments with natural holistic therapies, prayer, deep research, and divine wisdom. She'll talk about how cancer shaped not only her career in functional medicine, but also her spiritual walk and her clarity of her calling. But that's just the beginning. Years later, she faced other major health challenges, and each trial became a deeper invitation to heal, not just physically, emotionally, and spiritually, all of the above. And we talk about this all the time. Mind, body, spirit is so important. So what we're going to talk about with Dr. Jill today is why toxic burden is a silent root cause behind so many illnesses and symptoms that probably many, if not most of you, are suffering from. What functional medicine is, what does it mean, how is it different than conventional medicine, the importance of listening to your body and your intuition, no matter what the conventional medical community is telling you, how to make hard decisions without regret, and what it truly means to walk in step with God even when the path isn't clear. Dr. Jill also shares practical advice you can use right now, from how to detox your air, your water, how your thoughts and emotions directly impact your health, and how you can protect your future generations by lowering your toxic load even before conception. And yes, we talk about how she hears from God and how to hear from God when you're standing at life's crossroads, because sometimes the answer isn't just in the data, it's in the still small voice that says, this is the way, walk in it. So whether you're facing a health challenge, trying to figure out what's next in your life, or just wanting to be reminding that healing is possible for you or even a family member, this episode is for you. Enjoy this conversation with Dr. Jill Carnahan. All right. Well, Dr. Jill Carnahan, this has been a long time coming for me because I have followed you, listened to your lectures. I've gotten your newsletter for years. Everything you put out there, I'm just gobble up because for obvious reasons. And so I'm super humbled and excited that you said yes to coming on my podcast. And I just can't tell you how grateful I am. I think that everyone needs to hear what you have to say. You've got so much to share with the world, really, but with our little world specifically. So thank you.
You're welcome. I am so excited we got this together and to be here with you. And I feel the same. You put out such great information, and the more we can just get that out in the world, the better.
Yes. Amen. All right. Well, for those of my listeners that don't know you, the first thing I'm going to say is this woman is a powerhouse, and you talk about a phoenix rising from the ashes, if you will. You've got a story, and everybody has a story, and you've got a very powerful story as a physician and also as a human, and your journey to wellness. And if you don't mind, I would love to just get the background of that, your story. what happened, how you got where you are, what you were doing before, just whatever you want to share, I would love to hear.
You got it. And it's so funny because in hindsight, things become so clear. And in the time during it, it doesn't always feel so clear, but it really has flavored my entire life. So
that's for anything, right?
Right, exactly. Yeah. So true. So I grew up in a farm in central Illinois. I was one of 5 children. I was the oldest girl, and really like the most idyllic you could imagine. Like we had corn and soybeans. My parents had been married over 50 years, a wonderful family, supportive environment. And so you could look at my childhood and be like, oh my gosh, you had the best, most amazing childhood, a small town school where I graduated valedictorian. I just like had this great situation and supportive family. But unbeknownst to me, looking back, there were things on the farm that were slowly killing me. And I didn't realize that until I went to medical school, after getting my undergraduate degree. And I was in medical school studying to become a doctor, kind of my lifelong dream. I knew I had this like healer capacity. I knew that I wanted to do something a little bit more holistic, but I ended up going to conventional medical school because I felt like even now it's the best reimbursable system, not always the best, but kind of like I knew if I want to do mission work overseas or anywhere, it might be the easiest to actually do like practice medicine. So I went in coming from this background of like, we grew a lot of our own food. We had strawberries and potatoes, and I remember helping in the garden. And so very like close to the earth and that nourishment and understanding. Yeah. And understanding that was like how we stayed well and thrived. And of course, we'd get sick like any other kids. And our mom was a retired nurse. So she'd take us to the doctor, but it wasn't the first option. Maybe there's chicken soup and some tea first, or rest first, or some nourishment first. And then the second was go to the medical system. So I kind of had this ingrained idea that there was more than just medications and surgery. But I still felt like that was the right route. Well, all of a sudden, in my 3rd year, I'm 25 years old, literally a week after my 25th birthday, so just barely 25. I'm on my surgical rotation, and we're being taught breast surgery, breast self-exams. And for the first time, I reached over and just, touched my left breast under my arm. And it was almost immediately, it was like the first time I'd ever done a breast exam or even thought about it. I found this thickening. Yeah, I'm just 25. And of course, 25-year-olds generally don't think about their health.
Yeah.
And so, but I found a lump, and even at that moment, I was like, this is nothing, because you have no comparison.
Sure, yeah.
But what ended up happening is I got a mammogram, got an ultrasound, and it was highly suspicious. And I'll never forget, as a medical student, you're learning along with your teachers. So you go in the back and read the radiologist report.
Fear, oh my gosh.
Yeah.
Can't imagine.
So I remember seeing, that was my first inkling, because I was sitting there with the radiologist looking at this huge screen of my mammogram and my ultrasound, and he's describing the findings. He's like, these are, small calcifications that we would typically see in a 50-year-old with cancer. I'm like, and I could kind of tell that here he knew I was 25 years old, but that he had some concern. So I ended up getting a biopsy. Long story short, I get a call from the surgeon just maybe 2 weeks later, and she's like, Jill, you have aggressive breast cancer.
Wow.
So that was 25. Like 25. And at the time, like sadly now there are many young people, 20s and even 17 and 18, that are getting breast cancer. It's still rare. But at that moment in 2001, I was the youngest ever diagnosed at Loyola University in Chicago, where I was attending medical school.
Yeah. Wow. What a blessing that you went this route to just even discover it so young and so early.
That was a blessing, because had I not thought, it could have been way more
rotation. Yes. Yeah. Just being on that specific rotation. So, what did you do about the breast cancer? Did you do the conventional medical route, or what, tell me about that.
Yeah, that was a conundrum. And I think this is worth just briefly talking about, because those people out there that are struggling with the decision, what I realized was, here I am. I have the best medical library, the best medical advice in the world at my fingertips, and I'm being trained in medicine. But it was such a difficult, complex decision. And we think that when we have a diagnosis, it's black and white. There's just this one path. And what I realized was there was no path, especially not for a 25-year-old.
Sure.
So I had to really go through the literature and read and say, and even ask questions like when they said lumpectomy with radiation, well, does that improve mortality? The answer was no. It increases lifespan by about 6 months. I'm like, well, I don't know if I want to do that then, just because it's standard of care. So I dug deep, and then I took that information and made the best decisions. But I ended up combining pretty aggressive conventional therapy because of my age and the aggressiveness of the cancer. So I had 3-drug chemotherapy. One of the drugs was to maximum dose till I would get cardiomyopathy, which is the heart, failure.
Yeah.
and had many side effects. And then I had radiation and I had multiple surgeries. So I kind of had all that. But what I did while I did that was I had an incredible community. I had prayer support. I had connection with family. I did some naturopathic treatments. I had supplements and nutrition. So I kind of combined. I did this conventional plan with a ton of support around it of integrative medicine.
Yeah, and having that support is so vitally important, and prayer, and and your mental attitude around that, and is just the brain is powerful when it comes to healing the body. So obviously here you are. So you recovered from the cancer with the combination of that aggressive therapy, and then at some point, or at what point, I guess, did you recognize that, okay, the cancer's gone, but there's still some other stuff that is not right?
Yeah. And Terri, that's the interesting thing about it. I always say I would do nothing different. Here's one more pearl for those of you facing difficult decisions. What I did is I took all the information I could gather, and then I prayed and made the best decision in that moment. And I knew I would never, ever, ever, no matter what happened, I would never second guess that decision, because in the moment, because in hindsight, you can always go back and, oh, I should have done this. That life of regret is not worth living. No. So I knew no matter what happened. And what happened was I still have an immune deficiency, probably partially from that therapy that I got. I still have sequelae from that therapy that I chose, and I would not do anything different, but I had to pay a price for that. Sure. With my immune system dysfunction and things, because it was so aggressive. And I think that's always the difficulty, is a lot of the oncologists are rightfully so looking at life years left, but not quality of life.
That's right. It's very much tunnel vision. And I've had this conversation just being in the hormone world, of course, with thankfully the number of patients just with us doing a more integrative approach and to even hormone therapy and looking at, gut health along with that, and hormone metabolism, and trying to look at all the areas where, hormones, you got to look at the soil and where everything goes and what's your body doing with it. You can't just assume you're putting this fuel in the tank and it's going to go where it's supposed to go and not cause any problems. Right. And so the handful over the years of patients that I have walked out this decision with their breast cancer, that's the number one thing I think that has created success for these patients, is supporting them where they feel a sense of peace. Because if you have peace about it, that's information. If you're wrestling with something and you're just it's not sitting well, that's information, right? Mm-hmm. And it sounds like you were very, very much at peace about that. And that is such a great pearl for people that might be listening that know someone, or because if you don't, you will someday. Right. It's just statistically going to happen, to really walk that out and do the research. And clinicians, as you know, are trained only just how we're trained. And, we have the way we've been trained, and that's kind of what we stick to. I have a friend of mine that, she's a now 15-year breast cancer survivor. And she came to me, to get hormones, and she hadn't ever had a mammogram, and she was close to 50. Mm-hmm. And I said, I need you to get a mammogram before we do this. And so she did. And, she had a pretty aggressive breast cancer. Yeah. So she went and got, all the advice, and they did actually a double mastectomy. She had a positive lymph node involvement. So they did a double mastectomy, and she was sitting down with the breast cancer, the oncologist. And they were saying, okay, now we need to do all this chemo and irradiate the area and, just do all these different things. And she just stopped her and she said, I want you to just take your doctor hat off and talk to me like I'm your sister or your mother or someone very close to you. And would you be giving me this same advice? Yeah. And she just the doctor looked at my friend and said, no, I wouldn't. Wow. And she said, thank you. Thank you for being honest, because that's what's in my gut. So she was telling her all the things that is standard of care. Yes. You always said that, but it gave her peace to move forward with a more functional approach. And so she found, and there wasn't that many in 15 years ago, in Colorado. It could have been even your clinic. I don't think it was. But she found someone that was doing high-dose IV vitamin C and alpha-lipoic acid and, pulling sugar out of her diet and just doing all the functional approaches. Right. And 15 years later, she's still she's cancer free. Wow. And so I think that there's so much importance to be, just pearls there to take home of having peace, ask questions. Don't just take, one clinician's answer unless you're fully at peace with it, and then go. So are you looking for a healthcare provider who understands the importance of integrative medicine? Avexius Health Solutions is changing the way we approach wellness. We train practitioners on cutting-edge therapies focusing on a preventative care model. If you're ready to take a proactive approach to your health, Avexius can help you find a provider who's right for you. Just head to avexius.com, that's EVEXIAS.com, and click on the button Find a Provider to find a provider near you. This has led you down, obviously, this path into the functional medicine world. And so for those of us listening that don't understand what does that even mean, can you talk a little bit about functional medicine, what it means to you, how you do functional medicine in your practice?
Yeah, so it's interesting because I have been almost since the inception, there was this thing called alternative medicine back in the day when I was in medical school and even before that. And it was like the side things that and I always hated that term. And even to this day, I never use it. And
complementary.
It was, then it went to complementary and then integrative. But even then on those realms, what it was is a doctor in the office doing maybe a more holistic approach and asking about diet and lifestyle. But what they would do is they refer to acupuncture, massage therapy, chiropractic, traditional Chinese medicine. And these were alternative or complementary things that could be done alongside the conventional route, maybe a slightly more holistic history, but it wasn't really root cause medicine. So when I was in residency, like many, many people, I heard Dr. Jeff Bland, and I was like, oh, that's so systemic.
Makes sense.
Yeah, so systemic. And in medical school, we are taught the systems of biology, the biochemical pathways. I love that stuff because it was deep and intense. But in medicine, we're not typically going back to use those. The drug companies do. They try to figure out pharmaceuticals for whatever pathway, but we're not on a day-to-day basis using that information, although we've been taught it. So when I heard about functional medicine, and this was before I ever got out of medical school and even residency, I knew the moment I was like, this is what I want to do. This is why I went into medicine. I just didn't know there was a name for it.
Yeah, good.
So I latched onto that and I started my training in residency. So I was the resident in the inner city clinic that was kind of underserved populations that was doing like suburban housewives would come in to get their hormones because I was the only one that knew how to do that. And even my attendings, my doctors who were teaching me would be like, Jill, what are you doing there with that woman? She came back and was feeling so much better. And so I started doing it.
So that's great. So they let you do some of these therapies in the resident clinic? Wow.
Yeah, it was amazing because I had to be very careful. But then all of a sudden they're asking me what I'm doing. And it was and that's where I started was the endocrine axis of, thyroid hormone, adrenal function and female hormone replacement, male hormone replacement. And that's where I ground, my teeth and kind of learned. Right. And then I was the first group to graduate from the IFM certification way back in the day. And then it's been, ever since. So when I got out of residency, I was in family medicine for a couple years and I just started doing integrative functional consults and that just grew and took off right away. And now it's been over 20 years.
Yeah, it's amazing. And, I know over the past, I don't know how many years, it's been quite a few years. You've even kind of dialed in your functional approach and you've honed in on some really, I think, specialty areas with toxicity and mold. And, there's probably a story there as well that got you there. But I just want to touch on one thing you said, and it's so important, and this systems biology. And one of the most profound things that I've learned in the integrative and functional space, and even I did IFM's intense courses as well. I didn't do their full certification, so I didn't have time. Just having young children at home, that's a big time commitment. But I did enough. I got enough in to understand and be dangerous, as they say. But one of the things that I heard Dr. Jim Laval talk about one time, and it has stuck with me so much, is the body is a system of systems. And one of the biggest problems that we have in medicine today is we have all these specialties and they're tunnel vision focused on that one thing, the cardiovascular system, the endocrine system, the pulmonary system, the musculoskeletal system, the neurological system, the neurovascular system, the psychological system, and they all are connected. The gut is the biggest one that none of these, not many, I don't want to say none because there's some are, but not many focused, specialized clinicians really kind of take a step back and look at this body as a whole. And if I describe functional medicine to a patient, that's kind of how I describe it. Is it's us pulling the microscope and the lens back and getting a bigger picture of how all of this is fitting and what is happening, what's going on in your gut and how it's causing these symptoms in your brain, and et cetera, et cetera. So I love that pathway that you took, and you knew right away. I mean, and that's the other thing too that I love to talk about is when we have a purpose. I mean, God gives each and every one of us a purpose and a calling in our life, and you know what it is if you pay attention. It's that thing that you go, that's it.
That lights you up.
And that lights you up. Exactly. That makes you excited. People, I love to educate and teach. And, people say after we do, big conferences and I'm lecturing all weekend, aren't you exhausted? I'm like, no, I'm kind of really energized.
Right.
Because you see the light bulb going off and you're like excited because now these people are going to take some of these concepts home. But at any rate, you've really dialed in on in the last several years. I mean, you've always talked about toxicity, but it seems like you've really kind of got an uber focus on that. So tell me about that. Let's talk about toxicity.
Well, it's interesting because back in the day, someone come in for hypothyroid Hashimoto's or hormone replacement, 3 months, 6 months, they'd be 80, 90% better. They'd go home. They might see you once a year. Things were simple. And nowadays, what we're seeing is all of a sudden the complexity level is exponentially increasing because, and here's why, the elephant in the room that is causing exponential increase in inflammation and immune dysfunction is the environmental toxic load. So I had to be like, what else is going on? What is going on in our world? And this includes exotoxins like metals, parabens, phthalates, PFAOs, plastics now, which there's no binder for plastics. So all of these things that are exponentially increasing, and mold, which is a big one for me, and all of those things. And then endotoxins as well, which are also increasing. And that would be like our internal environment in our gut, a dysbiosis, bacterial overgrowth, SIBO, SIFO, parasitic infections, fungal infections, or even hormones in the wrong doses that we're not helping metabolism, or drugs. So of these internal and external toxins. And I would say functional medicine at the root is usually toxic load plus infectious burden. And some combination of those two create immune dysfunction and inflammation. And then that drives autoimmunity, heart disease, cancer, neurodegenerative diseases. And those are all the things that are exponentially increasing. We're seeing just huge rates of increasing autoimmunity, especially in women. We're seeing cardiovascular.
Younger people.
Yeah. Younger, and cancers, younger and younger and more aggressive. And all these things we know at the root are this immune dysfunction. And I always think of it as, I'm sure you've heard this analogy, and I'm not the only one to say it, but toxic load is like a bucket capacity that we're born with. And as we go, I was born with a very small bucket, and on the farm I accumulated pesticides and atrazine and glyphosate and other toxins, probably even in utero in my mother's womb. And then that bucket goes up and all of a sudden it starts to spill over the top. And we present like me at 25 with cancer. And I had a sister 7 years younger who had thyroid cancer at 28. So 2 girls in their 20s, same environment, same genetics. Wow. So there's definitely this thing of toxic load. For sure. And when that water starts to spill over, us as a clinician is not just to identify every last toxin in the bucket, but to implement detoxification strategies so that all of a sudden that water level, if they come down and get margin, the body naturally knows what to do if it's given margin.
Yeah, so we don't even have some room to breathe, you know, and do its work. Absolutely. Yeah. So how do you, gosh, there's so much to talk about here. Okay. So when you talk about just, let's break down a little bit toxic load and kind of get this out there in bite-sized pieces. So in the way I've kind of thought of it is it's almost like you can't avoid the toxins. If you're a breathing human, there's toxins coming at you. But there's some key, I think, small things you could do to avoid a lot of them. So I want to talk about those first. Yeah. And then I want to talk about some easy key take-homes. I want to make sure people are listening have some takeaways. This is what I could avoid. This is what I could do to, detox a little bit. And then, of course, we're going to talk about resources. But before we get into this global conversation of toxicity, talk a little bit about mold, because it's a confusing topic, and there's so much conflicting information online, obviously, and people are so confused about it. So give us your take on mold and what's important to understand about it.
So very briefly, I'll tell you, once again, God has me as a guinea pig because I just go through these things and understand them. And I was Boulder had a massive flood, of 1,000-year flood, like many places have had in the last decade. And much of it was underwater, almost $1 billion in damage. And that was 2013.
Yeah.
The next year, I started having shortness of breath, rashes, what you could now call mast cell activation. Like my whole system was affected by the mast cells that were kind of going crazy because of this exposure that I didn't know was in my environment. And I started getting very sick, brain fog, very exhausted, poor focus, poor concentration, rashes, infections, getting sick, and I could go on and on. And I didn't know what was going on until I tested. I was in a 2-story office on the second floor over a crawl space that was unfinished with standing water, over a basement that had Stachybotrys, which is a black toxic mold.
Just
all of that. Yeah, it was crazy. And all of that, what got worse after the flood because the basement of that office flooded, and I didn't know any of this. Now, even more funny, I had remodeled my office on the second floor, so it was beautiful bamboo floors, stone walls, and that bamboo carpet, some contractor who I just trusted didn't know any better, just threw that beautiful new bamboo floor over 20-year-old carpet, just like right on top. Boom. So every step on this soft bamboo was like pop. Now I can imagine it was just puffing. Rose
mold,
right? It was like literally like like accordion or something.
Yes.
Popping up that. I'm like, no wonder I got so sick. Anyway, I got really sick in that office. Didn't know what it was till I did the testing, did my own testing. And I found out I was full of trichosis veins, which is a black toxic, it's a mycotoxin from black toxic mold. And then we found Stachybotrys. So bingo, there's the problem.
Wow.
So for most people, here's why it's important. I could be sitting in this beautiful office and behind the wall, there's mold. I don't see it. I don't smell it. I don't know it's there. I just start having symptoms. So the number one thing that's free for people is a history. You and I can ask the questions, but if you're out there listening and you go, when did you last feel good? And then you say, and when do things start to go downhill? And are there other pets or family members that are also having autoimmune, allergic, or other issues? And if you put together a story, in 2018, I moved to a new home. There was a flood in the basement. We cleaned it up. And 2 years later, 1 year later, we all started having issues or something like that.
You got to be your own detective, right?
You do. And you don't need a doctor like me, although that's part of my job is to guide you and ask questions. But if you just think through your history and make a timeline, often people can identify when they felt well, when they didn't feel well, and put together some of the story. And it might have been a divorce, a loss of a loved one. There might have been stressors. But there's also these environmental things. So whenever I have a story of someone changing environments, or they go camping and they feel great, or they go to Hawaii for 2 weeks and they feel great. So those are clues.
Yeah.
Right. And then behind this wall, there could be a colony of mold. It could even be dried and dormant from an old leak. But at some point, those molds excrete mycotoxins. Mycotoxins are less than 2.5 microns. They're sometimes even 0.1. They can go right through that wall. They can go right as we breathe into our alveoli, which goes directly to the bloodstream without any transport. So if you walk into a moldy building, you can literally feel symptoms within seconds because your alveoli has no bypass, no protection from that small of mycotoxins. And those then accumulate in your tissues. And eventually you can actually become toxic with those mycotoxins, not mold. This isn't colonization. Right. Those are too big to ever get into your body. But the toxins they produce can definitely accumulate, and we can now measure them in the urine. And I will say a lot of people out there on, social media, I have mycotoxins. They can be from food. They can be from environment. It doesn't always mean that you have an exposure. But if you have a known sample in a wall and in your urine and it matches, there's probably a connection. And that's kind of how people can figure out if they might have mold.
Yeah. Wow. And so I'm just so curious, like you got so sick, but did any of your staff get sick?
Yes. Yeah. In hindsight, we all were affected to some degree. And again, it's so weird because
it's subtle, probably.
Yeah, it's subtle. And it can kind of take away what I wrote about it in my book as well. And it's so interesting because there's this thing that mold does. It takes away your insight. So even now, I am a mold expert. I've done this for over 10 years. And I can be in a moldy building and be like, why do I feel so achy? Why do I feel so foggy? And then hours later, when I go home and take charcoal, I was like, it was a mold exposure, of course. But it's the weirdest thing is often in the midst of it, or you'll be I remember there was this church I went to one time that was super moldy. And I love that Sunday. Like, that's a great thing for me. But I'd come home and I'd be like depressed and sad and tearful.
And
I was
so
like,
it's
what is going on?
Weird symptoms. Like, why am I feeling this way? Yeah. And even sometimes, I can walk in an old building and smell it. And just, it's not a smell. It's just, it's this damp, musky, it's not fresh. You can kind of tell if it's a really toxic building. So as far as just general toxicity, another question I had, and we talked about epigenetics a little bit, and what that means for all the listeners is things that are happening to the fetus in the womb. And so how much in your just experience and research and working in this space do we see true toxicity transferring from mother to fetus? I've seen it in psychological, like anxiety,
right,
things like that. And of course, food. And now we're seeing gut microbiome changes because of the mom. And how is all this crossing over? It's so important for pregnant moms to understand this stuff too.
Oh my goodness. It is so true. And one of the big things that I've just been investigating is like plasma exchange. We can talk about that later, but this is like actually an oil change for your body, right?
Yeah.
And one of the biggest populations I think we should be targeting is women who want to conceive so that you don't pass that load on to your children.
Yeah.
So 2001 happened to be the same year that I was diagnosed with cancer many years ago. And that year in Canada, a cord blood study came out. And there's been some since then, but that was one of the big ones that was like a big aha. And these basically, they take cord blood of a baby, newborn baby, never had any exposures except for mother's womb. And most of them averaged over 200 toxic chemicals in the cord blood. And this is over 20 years ago. So that was a shocker because you're realizing we're coming into this world with a toxic load, right?
Burden. Yes, exactly. Yeah. And then we're, adding insult to injury, which, we can talk about it, but there's got to be something to be said about coming into this world with that toxic load and getting all these vaccines right to the womb. Yeah. I don't want to, we talk very open and honestly about vaccines on this show.
Terri, I'd love to say something about that because I feel really strongly and they're really balanced. Okay.
Yes.
How's this? Say you have a blockage in your left main coronary artery and you don't know it. You're walking around. You're not having chest pain. You're fine. The cardiologist says, oh, you're 55. You're at risk. Let's put you on a treadmill because we want to stress that heart and see if under stress of a high exercise Bruce protocol that we will reveal a defect in your heart. And that guy gets on a treadmill and like, oh my gosh, you have a 90% blockage of your left main artery. Let's take you right away and put a stent in. They save his life. It is exactly the same. We take 1,000 kiddos. 2 of those kiddos have mitochondrial dysfunction, detoxification issues, proneness to inflammation. We stress test them at birth with a vaccine. This vaccine is not bad. There's nothing wrong with vaccines. But the adjuvants in there, the aluminum or whatever thing that's in there to poke the immune system to get a response, it's made to do that, is a potent stimulator of some of these kiddos' immune dysfunction. And so they all of a sudden they stop talking or they stop.
Right.
And it's all a mitochondrial issue because their particular mitochondria was stressed, just like the heart of a 55-year-old man, and they couldn't handle that. So I love talking about this because there's
not throw the baby out with the bathwater. Let's really get
but there are real people genetically that don't tolerate it, and there are real vaccine adverse reactions. So we have to be talking about it because we all see it in clinical practice.
I agree. And it is just, I love even just having this conversation about, toxic burden with the fetus, because there's so many, I think there's still so much misinformation that whatever I'm doing as a mom and breathing and what I'm putting in my brain and my thoughts and my psyche and my body is not, there's a separation, but it passes on. We're seeing that more and more and more, especially in the, moms that undergo trauma during pregnancy. We're seeing major, neuropathways.
HP axis, yes, exactly.
HP axis issues in children. I'm working with a young lady with that exact thing right now at 21. So let's move on a little bit let's give us a few, let's talk a little bit more about toxicity. We talk about mold, and you kind of started talking about these 2 buckets of toxicity to pay attention to. So go a little bit into that, and then maybe we can wrap up in the next 10 minutes with, some pearls on things that we can look for and do, etc.
Got it. So this topic can be so depressing because we are all in toxic soup. So I always love, and what I love is my suggestions, my solutions. You don't need an expensive functional medicine consult, although that might be nice. You don't need a bunch of expensive testing, but there are certain things we can all do. And I love to keep it simple. So I always say clean air, clean water, clean food, and then clean mind and clean body. And I'll go through those real briefly.
Yes.
So clean air, 80% of our environmental toxic load is from the air that we breathe. People are surprised to hear that. So very simple things. You should be replacing your furnace filter very frequently, as soon as once per month. And I do it like every 3 months, but not 6 months or 12 months. You want to have a regular schedule. You want to get the highest rating of filtration that you can fit into that furnace.
Yeah.
Now, you may pay a tiny bit more because the thicker it is, the more the air has to blow through, and you might use slightly more electricity. I think it's worth it.
Worth it.
And a lot of those have carbon filtration or allergen filtration, and just get the highest MERV rating that you can get into that slot in your furnace.
Okay.
Nowadays, you can actually buy a furnace with add-ons with some of the UV filtration and some of the static filtration. Those can also be helpful, but be careful if you have lung issues. The UV filtration can take microparticulate in the air if your air is somewhat dirty and turn it in, oxidize it. So it doesn't create ozone, but as it interacts with those particulate, it can create ozone as it interacts, and that can be irritating to the lungs. So I'm more cautious on the UV in someone who has lung issues.
Yeah.
And then you want to have standalone filters that have a HEPA filtration, which is a particulate, plus a VOC filter, which usually means it has a carbon or zeolite core, which will pull out formaldehyde and VOCs, volatile organic compounds and gases.
Can I pause you just real quick? On when you're saying furnace in Texas, we're
HVAC.
HVAC.
Yeah.
Okay, good. I just want to make sure. Okay, good. Keep
Go
going.
whatever
Whatever the terminology
of your house. Yeah. And if you have those splits or any of the kinds of things for cooling, there's all kinds of other things. Every one of those need to be maintained, because if they have water in them or condensation, they can be an issue.
and you see this as a problem in apartment complexes and things like that. Anyway, keep going.
Yeah. So the air quality and standalone filters are great. I like IQ Air, Austin Air, Air Doctor, and there's more. Those are just the top 3 that I use. In my home, it's 1,300 square foot condo. I have 3 air filters. In my office, I have 5. You almost can't get enough. You maybe just need one, but it doesn't hurt to have a few of them around your house in different areas.
Yeah, and those are those freestanding standalone filters that, okay.
Yeah.
And
I want to make hard too.
IQ
Air, Austin Air, and the Air Doctor are my top 3.
Yep. Okay.
Yeah.
Good.
And those all work. They all have the carbon filtration and they all have the VOC filtration.
Love it.
Some of these are a little pricey, but they're worth it. To me, it's one of those really important investments. That's clean air. And you want to make sure you don't have mold in your house, of course. So if you don't know where to start and you think there might be an issue, there's a lot of controversy out there, but I'm going to tell you what I tell patients, because you don't have to hire the inspector first. You can do a little investigation. Yeah. I like this thing called qPCR. It's also called ERMI, but ERMI is not validated and the science behind it is not very good. So I like to call it by the technical name, which is qPCR, because any mold inspector will know what that is and respect. It's a DNA sample of the dust in your home for mold. Yep. And that'll give you a whole spreadsheet of mold. And if you see any really...
you can just get that kit online, can't you? Yeah, exactly.
I think it's mycometrics.com. I think there is Dust Test, the Dust Test. And I think Envirobiotics. Those are the 3 that I know of that do that. And you can order it online. It's about $300. It's worth it. Yeah. And you can do your whole house with one sample if you want to start. Just kind of test it and see. So start there. And then if you find some, then you need an inspector to help you figure out where it's at. But you can start with that dust sample. Yeah. So that's clean air. Clean water, kind of self-explanatory, but you want to make sure if you can do a whole house filter, your drinking water, your showering water, your bathing water, your cooking water should be filtered. I never drink tap water. In fact, I have a thermos that has a filter in it if I'm traveling and can't get clean water. Try to avoid plastic water bottles. That's hard. And sometimes traveling, you just do what you can. But if you can find glass, at least do that, or take your own water bottle. And then just make sure you're checking. Nowadays, even Superior, one of the communities beside us, there were some toxic metabolites in the city water. Mm-hmm. And if you just look at the report, they're right there. Yeah. So water is crucial and you need a good source. And if you are using RO, which is reverse osmosis, that's a great filtration system, but it depletes the minerals. So you should be taking a mineral supplement or remineralizing your water if you're doing that.
Yeah. I have a question. What do you think about these fancy plastic filtering straws that have come out?
Oh, interesting. No, I haven't.
Oh, I have to send it to you. So a neuro scientist person that I work with that does these treatments sells them in her office, and they're kind of big, but it's apparently filters plastics out of the water. I don't know. I'd love to see if it's validated, but I'll send it.
That would be good, because I think honestly that I even have a fridge filter that works really well, and it does filter out the microplastics. And I think that we have to be thinking about that, because as of today, unless you're doing plasmapheresis, which is that plasma exchange, I don't know that we have a binder or anything to pull out plastics.
No,
I don't know of anything.
Just accumulating in our, I don't know where, tissue.
Right. Brain and heart. And
Yeah. Okay. So clean water, clean air.
And then clean food. And again, this could be a whole hour. So briefly, you want to be local, organic whenever possible. If you're doing any meats, you want grass-fed, no hormones.
Yep.
You want, for example, farm salmon, one of the most toxic things you can eat, but wild salmon's one of the best. So you want to really pay for those things that matter. You can go to Environmental Working Group and get the Dirty Dozen, which is the top 12 fruits and vegetables sprayed with pesticide. And if you want to put your money in something, at least for sure, and get those organic, for example, strawberries is almost always at the top of the list. So if I'm out and about and I see this beautiful bowl of strawberries in a restaurant, I usually don't eat them unless I know they're organic, because that one is so toxic and typically linked to pesticides. Yep. So the food matters and the quality matters. Yeah. So,
and what are your thoughts on, I've seen this kind of on Instagram reels going around, and I think there's probably some validity to this, but a lot of people will soak their berries and things like that in baking soda water. What are your thoughts on that? Is that helpful?
I think both vinegar and baking soda can be phenomenal because they kind of act as a emulsifant or surfactant to pull over. I also use like mineral cleaners and spray lightly and rinse with water.
There's
cleaners.
Some sprays that you can as well. That's good. Okay. Clean food. And, I do want to talk a little bit. I talk a lot about food. That's kind of one of the biggest topics we talk about is gut and food, because all disease begins in the gut, according to Hippocrates. But so many people think they're eating clean. So I love how you just broke it down. Organic, grass-fed, as much as possible. I know, we live in a world where it's very difficult to, and you don't want to overstress, about it, but as much as you can mitigate. And the other thing too, that's important, I believe, is if you're going to store your food, store them in glass containers, and don't heat your food in plastic containers, things like that. And
get a little countertop convectional oven and avoid the microwave. I mean, I'm not like anti-microwave. I have one, but there's no reason we can heat it without using that ionizing radiation, and that destroys enzymes. So I just say use that little conventional oven, heat it up. It takes maybe 5-10 minutes more. And the other thing you mentioned, I actually think, so organic's great, all great, but sometimes you're getting strawberries that are shipped from California in a truck for 2 weeks that are not picked ripe. So if you can get local farmers that you support,
better.
Even if they're not certified organic, because a lot of the small farms can't afford to be, but they don't use pesticides, I would rather have a non-certified or non-organic, but technically cleaner local source of meats and vegetables and fruits than I would to get a commercially available berry carton that's been sitting for 2 weeks.
Absolutely. And plus, you support your local farmers. I mean, gosh, we've got to do that more. My daughter and I go to the local farmers market around here every Saturday.
I love it.
Fun.
It's like
buy your eggs, buy your meat. In Texas, it's the only place you can really get raw dairy, et cetera. You can't buy it in the stores and things like that. So that's really great. Okay. So food, air, water,
and then clean mind. And that's just like, how do we talk to ourselves? What's that? And I could go again an hour on this, but those recording voices in our said, oh, you're so stupid, or what? Those things matter. We need to reprogram them. We can rewrite our script, and we all have that capacity. And we just have to identify. But then there's also things like emotions, like loneliness, jealousy, anger, unforgiveness. Yeah. So huge. So you don't want to carry those weights. And the unforgiveness hurts you way more than the person you're not forgiving. So you want to examine that. Let it go. It's just.
And thoughts are things, Dr. Emoto's, I know you've seen the rice test. It's all over the internet. If you guys don't know that are listening what the rice test is, just go, because it started with actually water crystals is how he did it, but it's been repeated where there's three jars of cooked rice, and you talk very bad and mean and say bad things to the one jar, and you ignore or basically neglect the other jar and speak love and life over the other jar. And it's amazing. And this has done over and over and over, and it's all over the internet. The bad speaking things is black mold rice. The neglected one is yellowy molded. And the after 2 weeks, and the rice that was sitting in the jar that was spoken love and life over, totally good. No.
Wow.
That's amazing. So the rice test. Okay. Well, I want to talk about wrap up with your book. And you've just released an amazing book all about toxicity and resiliency. And I want you to share that book as much as you want to talk about it, and also other resources, people getting on your podcast, your newsletter. I learned so much from you, and I want to make sure all my listeners can learn from you as well.
Oh, thank you. Thank you. Thank you. Yeah, let's see. So the cover, because it's become an art. I love the art in there.
Pretty, yeah.
So, unexpected. It's funny because I was going to do a book about environmental toxic load and all the good things, like the to-dos, right? And then as I went through prayer and meditation, I was like, you got to tell your story. And I was like, no, I can't. But the truth is, what happened is it's a memoir, and it is a story of how I got through a toxic mold, Crohn's disease. We didn't even talk about that, breast cancer, and autoimmunity, and many, many, many different illnesses, and how I navigated that. And then in the sidebars is the practical how to detect mold in your house, or how to shift your emotions, or how to be in a healthy relationship. And I just kind of traversed my life, and then several case studies of my patients in the book. And what I really wanted to do with that was give you a glimpse into the struggles and the difficulties, not just the happy, successful Jill, but the struggling. And after my divorce, when I almost, it was so difficult. But then how did I actually navigate? Because we're all, like you said, I loved how you started the show. We all have a story, and every one of you out there has a story. I am not unique. But when we tell the story, that is our connective tissue to other humans.
Right.
And what happens is, as we open up with our struggles and our fears and our things, we find we're all the same. And so I really reveal a lot in the book about my own struggles and how I fought through and overcame them, just so that I can give you guys a little bit of a roadmap to, if you're struggling at all of any of these kinds of things, that maybe you can take a tiny little pearl and grab onto that like a lifesaver, and then to have your own healing.
I love it. And it's very, it was very courageous of you to write that book that way. You still got to get across what you needed to get across, but also with the human aspect, which is the human element, is what it's all about. And so for everyone that was fervently taking notes of things she was saying to do, they don't have to. Just get the book. It's all over the book. And also we'll have the link to your website, where I'm assuming they can get your book there, or on Amazon, I'm assuming.
Anywhere books are sold, yeah.
Anywhere books are sold, but on your website, which is
JillCarnahan.com. Just
JillCarnahan.com. And that is going to be in the show description. They can sign up for your newsletter. They can find your podcast there, and also find your book there, correct?
Yes.
Awesome. Well, I know you are super busy, and it took us a while to get this conversation together, but I hope we can do it again and maybe go a little deeper on some of these topics. That'll be a lot of fun, but I can't tell you how much I appreciate and how, again, honored and humbled I am, really, that you came on and shared your journey and all your knowledge with us today.
Thank you. It's so fun. And thank you for the wonderful love and beautiful work that you put into the world as well.